So for many of you, I know you've been thinking about this, maybe since you got the news you're pregnant. Should I breastfeed or bottle feed? Is breast milk really the best milk? Let's talk. Welcome back to Pocketbook Pediatrics. I'm always so happy to have you here. I'm Dr. Rochelle Ann Brown, and today we're going to be talking a bit about breast milk and breastfeeding. Or is breast milk really the best milk? Or really, what are the benefits of breastfeeding and breastfeeding? So I know we're going to talk about that today, but I must start off by saying that I do know that there are some times that breast milk cannot be offered. Maybe there's a medical reason, or sometimes it's difficult to offer. Maybe you are having some difficulty with your breast milk coming in, or maybe you may feel pressured to breastfeed exclusively because grandma and mom and auntie and the ladies in your life are encouraging you breastfeed only, or maybe even from the clinical level, the staff at the hospital are encouraging you breastfeed, exclusively breastfeed to help your milk come in. But do know that the best fed baby is a well-fed baby. So if you do have to offer formula, there's no shame, there's no harm in offering formula at all. And this is the most appropriate supplement for a baby when breast milk cannot be given. So we want to know that baby is well hydrated, is happy and full until such time as you can offer your breast milk exclusively. Okay? So please go ahead and offer formula if you need to or if you choose to. All right? So having said that, we're going to talk a bit now about what the benefits of breastfeeding and breast milk are. And there are many, and they include benefits to both the mommy and the baby. So let's start off about the baby. Firstly, breast milk really is the best mix of nutrients that your baby could get. It has the most and the right proportions of fat, carbohydrates, and protein, and the minerals that your baby needs in the right proportions just for your baby. Breast milk has this wonderful property of being able to respond specifically to the needs of mommy's baby, which is something that formula can't do. It does change from stage to stage, but it can't respond from feed to feed, and breast milk does that. So mommy's body responds to exactly what the baby's needs are, and breast milk produces the right proportions of everything for that moment, and that's beautiful. Secondly, breast milk contains a lot of other proteins and enzymes and little supplements that baby needs to help with the protection against infection and also with the development of their gut. And once they have good gut development, it also means it helps with their passage of stool, reduction of colic, and those things that sometimes are a problem later in the newborn and infancy period. So breast milk helps to be protective in that way. Now, when we talk about the proteins, particularly we think about ones called immunoglobulins. Now, these immunoglobulins are important, particularly in the first 6 months of life, because they help in giving protection against infections, particularly. And we need that because in that first 6 months of life, babies just learning how to build their own immunoglobulins and just learning how to fight infections for themselves. So it's very important that they have that extra coverage. And this is why as well vaccines are offered to help babies to have that boosting to build their immunity as well in that first 6 months of age. All right? Thirdly, it reduces the risk of disease and illness both in the short term and the long term. So when we talk about short-term illnesses, we think about things like gastroenteritis or GE, which we've been hearing a lot about in the news in Jamaica recently. We think about respiratory illnesses. So, when baby goes out to the daycare, they start to get cough and cold and runny nose and sniffles, and they seem to have it often. There's some protection offered against illnesses and the frequency of illnesses like those. We think about coronavirus as well and COVID-19. There's some protection there. And other infections like air infections, urinary infections, blood infections, which we call sepsis. Sometimes babies do get blood infections and need to go to hospital. There's protection against that. And there's also protection against something called sudden infant death syndrome, which we'll talk about in a later episode. In terms of the long-term protection, we think about obesity. Type 1 and type 2 diabetes, or what we call sugar here in Jamaica. wheezing illnesses like asthma, allergies, and inflammation of the bowel or irritable bowel syndrome. Fourthly, there is greater development for your brain, your ears, and your eyes for baby. So there have been studies that have been shown that there is faster development of hearing and vision, and there's also an increase in their brain development in terms of a higher scoring on the IQ testing when they're older. So this can speak to their school performance when they're older as well, that there is some suggestion that breastfed babies have higher or will lean toward having a better school performance than those who are offered formula. And fifthly, this one is not set in stone, but there are studies that are ongoing to see whether or not there is some relationship between breastfeeding and behavioral illnesses like ADHD and autism spectrum disorder. Now, as I said, it's not set in stone, so there's no direct relationship that has been seen, but there's a suggestion that there may be some benefit, especially if your babies are breastfed at least up to 4 months old, so that they will be protected from these behavioral diseases. All right, so that deals with the great benefits for baby, but what about mommy? Mommy has quite a few benefits as well. The first is that it reduces your blood loss directly after delivery. So how does this happen? Now, in the action of breastfeeding, not just giving breast milk alone, but actually breastfeeding, it tells your womb now to close down on those large blood vessels that have been being used to feed your baby during your pregnancy, and focus the direction of sending your blood elsewhere to heal the wound, maybe you had a C-section, or to help with the delivery of oxygen just to your body to give you energy. Okay, so the less blood loss you have, the less likelihood that you'll have what is called anemia or a low blood count. And when you have a low blood count, you have low energy levels, and as I said, wounds don't heal as well. You're just not as well as if you have a good blood count, right? And you know that's something that was focused on in your antenatal period as well, having a good blood count. So it's important for you to have as little blood loss as possible. Secondly, it is a natural form of birth control. So it does delay the onset of your menstrual cycle after your pregnancy. Now, this one too is varying from female to female. So I can't say it will be 6 months, 2 weeks, 5 months, I don't know. But it does depend greatly on whether or not you breastfeed only or whether you're intermixing breastfeeding and formula feeding or bottle feeding as well. You still do need to have a conversation with your OB/GYN about what your post-delivery contraceptive plan will be, because as I said, it does vary from woman to woman. Thirdly, and very importantly, it protects against illnesses in mommy as well, and particularly the female cancer. So we're thinking about breast cancer, ovarian cancer, and endometrial cancer or womb cancer. And these effects are seen long after the cessation of breastfeeding as well. And that's very important, not just to mommy's health, but to the family's health. Right? It protects as well against heart disease and hypertension, or what we call pressure here in Jamaica, as well as type 2 diabetes for mommy as well. And finally, there's an economic benefit. Now, this one is probably a great one as well. Who wouldn't want to save a little bit more, right? So breast milk is always available, it is always warm, and there is no waste that is produced from offering breast milk and from breastfeeding. Okay, so this is beautiful for the family, and it also will help reduce the burden on a societal level as well. So when there's reduction of waste, that's beautiful for the environment, it's beautiful for society, but also there's a reduction in the admissions to hospital or presentations for assessment for both mommy and child, because it reduces all of those illnesses that we spoke about earlier. So all of these things are wonderful benefits both to mommy and to child for breastfeeding. And I must say, as pediatricians, our preference really is that a mommy would be able to and chooses to breastfeed. So as I've given you some things to think about today, I hope it will really help you to come down on one side or the other in your choice for your family. If you're choosing whether to breastfeed or bottle feed or mixed feed, that's an option as well. But I hope that these pointers will really give you something to help you cement what your process will be for your family. So thank you so much for joining me today. I really enjoy being here with you. And I really do look forward to seeing you the next time on Pocketbook Pediatrics. God bless.